For the record, I have signed the petition and allowed my name to be posted with my signature in the petition. And I have joined, as of last night, more than 20 million signatories throughout the world asking for the probe of Fort Detrick. This petition, if you would notice, is a petition. The WHO may not act upon it, but this petition is born out of the reality which we have to connect to the 1972 Biological Weapons Convention, which was signed in 1972 and came into force in 1975 with the Philippines, China, United States as among the signatories. One of the two main problems of this Biological Weapons Convention are that there are insufficient institutional support among state signatories, and number two, the absence of any formal verification to monitor compliance. So if you would notice, unlike in the Nuclear Proliferation Convention, there are some UN accredited bodies who would do the monitoring of the compliance. In this case, the member signatory states are left whether they to comply or not.
Preposterous for the United States to be pressuring the WHO and its Director General to waste precious time by sending a second mission to Wuhan to investigate. There are no new allegations indicting China any deeper. So why? As in all legal cases, you must need new evidence to reinvestigate. There is no such new evidence. The questions that are lingering are the evident cases or presence before December 2019, before 2020, in the other countries. The logical direction is to widen the search net as much as possible to get to the bottom of where patient zero originated. The WHO is racing against time. We, the world, mankind is racing against time. There is now the Delta variant. There is a Lambda variant. What other variants will come? We therefore affix our marks, our signatures to this appeal, hopeful that in joining millions around the world seeking a common ground to allow science and not politics, and definitely not racism to rule.
This is the one that created an impact on me, because this facility, the Springfield Village, a retirement community for seniors, is less than a mile from where I stay in the United States when I go home to my family. This means also that none of the more than 300 U.S. servicemen who played in the Wuhan on October 2019 could have contracted the virus in Wuhan. The more plausible explanation is they already had the virus before they entered China's borders. I am, of course, not a virologist or a medical practitioner, but my common sense tells me that the viral transmission that occurred in Wuhan was not a lab leak, neither was it an animal-to-human infection, but a human-to-human transmission.